Welcome to the Care Social, where we discuss the biggest topics in social care right now. Whether you're a health and social care provider, a frontline worker, or just passionate about making a difference, we're here to bring you expert discussions, insights, and real stories from the sector. I'm Barry, Content Operations and Delivery Manager here at QCS. In this episode of the Care Social, we're joined by Michelle Corrigan, Programme Director at Digital Care Hub. Today we're talking all things digital and cyber, so thanks for taking the time to speak to me today, Michelle.
No problem. Thank you for having me, Barry.
So let's dive in then. Who's Michelle Corrigan? More importantly, we want to know a little bit about some of the awards that you've won. Tell us about you, where you've come from, how you've got to where you are, and about these fantastic awards.
Oh, well, talking about myself is one of my favourite things, so this might take up a lot of the podcast. I've got one of those really squiggly careers. So obviously started off with a philosophy degree, which I use all the time. Nobody can tell me that I don't. But I've been in and around health and social care for my whole career. I started off in public health. Some of you will remember Talk to Frank, the National Drugs Helpline. I was Frank for a little while. I did sexual health training. I worked in a rape crisis centre. I have worked with refugees, with adults with learning disabilities. I've run supported living. I've run offender services. If there's something the public sector doesn't really want to pay for, chances are I've done it. So I kind of meandered my way around business development, around operations management, and found myself in kind of like transformation roles. I was the person that you brought in when something was really hard, wasn't going well, or nobody was quite sure how to do it. So if you think about cybersecurity for adult social care, it ticks all those boxes. I started this role as Programme Director for Better Security, Better Care about 4 years ago. And it was literally presented to me like that. We're trying to do a big, difficult thing. We're not sure how to do it. Do you fancy a go? And I was like, absolutely, sounds right up my street. Some of my passwords, though, are my name. Definitely not a cyber professional. So I very quickly got on board with the cyber side of things and really fell in love with cybersecurity in a way that I wasn't expecting to. I was expecting to love the people side of things, love being in care and love working with providers because that's where I've always been. But actually, the more I dug into data and cybersecurity, the more I thought, this is actually really fundamental for us delivering good care. And I've shaped our programme around that basis, that everything we do isn't like cybersecurity is not a means to an end in itself. It is a route for us to be sure that the care that we're delivering is really good. And then, you touched on the awards, and I've been so lucky. This year, I was named as one of the most inspiring women in cyber, which was an illustrious list that I was absolutely not expecting to be on. I was just really proud to be nominated. And, there were people on that list who were running global organizations. There was someone who's, she runs operations in cyber for the Ukraine, like really people who are transforming the world. And I thought, how wonderful that in all of that noise and all of that work that's being done, social care got a nod. Because really, it wasn't me that won the award. They were like, oh, we hadn't even thought about social care. And that's where I find myself all the time. I then also won the NHS's Cyber Leader of the Year. Now, social care and the NHS have a rocky relationship at times. And again, they recognise that the best thing going on in the NHS at the moment is social care. So I was really proud again, because it was just a recognition of all the work that goes on. Because our programme, whilst we are small, we are absolutely mighty and we are punching well above our weight. And we have been for the past 4 years. And we really, I can hand on heart say we've transformed cybersecurity for adult social care. And that really, I think, is culminating these awards this year. So whilst my name is on them, they're the awards for the programme, for all the hard work that I and all of my stakeholders have done.
Right, so it's a job well done for everybody then. And I think for me, one of the things I picked up on your intro there, and it's part of the reason that we ask it, you're very clearly a social care grown individual. So you've grown up in that with the supported living and the offender services and mental health. So to have somebody with that kind of background actually leading on digital social care for social care, gives a lot of people in the sector the confidence that you actually know the sector. You're not somebody coming in from outside and dictating, so you can impact things from your experience in your career. So that's a real plus point for me. So let's start then. Explain to people that are listening what is cybersecurity. It's such a big issue in social care right now, and people still don't understand it.
Yeah, I mean, it sounds fancy. For me, cybersecurity sounds like something in the future, but it's absolutely a problem of today. And I would peel it back. Like, we think of cybersecurity, but really we need to start by thinking about data security. Thinking about, as social care providers, how much data we are holding on people that we support and our staff. Like, we know everything. And I would say far and above really what the NHS know. We could tell you Mrs. Jones likes a cup of tea on a Tuesday afternoon, but she won't have one on a Wednesday because the television programme isn't right. That depth of knowledge about a person is so personal and so precious. And we keep that information. And we have a real duty of care to keep that information well. Now, as we transition to a sector that is more and more digitised, we use more online systems, we are keeping more records online, well then we are entering into a world where cybersecurity is a real risk for us. It's a real risk in terms of data breaches and someone doing things that we don't want them to do with that information. It's a real risk with data integrity, that we're recording the right things in the right way about the right people. And it's also a risk in terms of like our systems. If the worst were to happen and a cyber incident, a ransomware attack, for example, were to take out your systems, how are you supporting the people that you look after, which is why you exist? So when something can absolutely cripple your service, not for 3 hours, 4 hours, but for 6 months, then this is something we really need to be taken seriously.
I actually fell for a phishing email last week. Come from Microsoft Teams, saw it was somebody trying to get in touch with me, clicked on the link and it opened it up and said, haha. Luckily for me, it was a test that our company were doing to see whether anybody was like following the procedures and everything. I got caught out. So I then had to email somebody and say, by the way, I did open that. And luckily it was just a test. But it is so easy. The people that are doing the phishing and the cyber testing to try and get into your systems, it's just, unless you're looking at the really granular level, you can be fooled.
Oh, it's so sophisticated. And and I think the thing that people get very worried and they get really, can say, like, I don't want to be the one to click the link. I don't want to be the one. But ultimately, there are things you can do to protect yourself. But the most important thing is to remember that all of it is a risk. And no matter what your job is and what your role is, you are a potential front door. But at the same time, your organisation has things in there to protect you. Most organisations run a no blame policy when it comes to cyber, or, some sort of, I'd rather you told me quickly, I'd rather we found out about it, than it go, further down the chain, because once you've clicked that link, the floodgates have opened. But it is remembering that cybercrime accounts for about 50% of all crime in the UK. Most of it is perpetrated from outside of the UK. So, this is a huge industry that is absolutely trying to get the information that we hold. And, health information, which, extends to social care, is now more valuable on the dark web than credit card data, which is terrifying.
Crazy. So many providers, because of everything that's going on and all the things we see in the news and that, many providers feel overwhelmed by digital requirements. So for me, what's one myth or misunderstanding that you hear all the time that you could resolve for people listening right now?
I think I hear all the time, well, paper was easier. And I go, what was it? What was it really? How many times was something left in a taxi or on a bus? And how many times were the notes just not good enough? And did you ever find a way to take all of those paper records and then make decisions about your business and decisions about the care that you provide? Those things weren't available to us. So I think the opportunities that are afforded to us by digital are enormous. And again, going back to your point, Barry, I'm a social care board. The thing I care about more than anything is that we provide good care. And my A-level maths teacher will be surprised to hear this. The data really interests me. The idea of some of the predictions that we can be making, the patterns we can be noticing in that data, which we can only have if we have it all in one place, which necessitates a digital solution, is really exciting for how we look after people more efficiently, more compassionately, and really keep people in the part of care that it really matters. So, and we're not going to get through this podcast without talking about AI. and people are talking about, AI is coming to take your jobs, AI is coming to replace people. I'd love to see AI replace a really good care worker, because it couldn't,
Not going
We
to
are
happen, is it?
the industry of human empathy.
Yeah.
And digital and tech provides us a really big opportunity to ramp up the human empathy, that element, to really put that to the forefront, because all of the nonsense and the stuff we hate about our jobs can be taken care of by digital solutions.
Yeah.
I love an AI meeting transcription, because aside from anything, it pulls out all the times that I said I'll do this and forget the minute it's left my mouth. It's a really small thing, but it makes my life easier, and therefore lets me focus on the bit of my job that I love, which is meeting people and talking to people and persuading them that cybersecurity is important.
Yeah, and I think for me, rolling AI into social care so much more, it's not about replacing jobs. It's about freeing people up to sit down with Betty and spend more time with Betty, talking to people, getting to know people more, and having those really quality interactions. Because that's the bit that it isn't going to replace. It's going to support people to do that better job. We will embrace it once we get over the fear that it's not going to take your job away. What is digital readiness then? We hear people talking about that a lot. So in practice for social care providers today, what is it? And more importantly for me, those small providers with no IT support, how can they build confidence around digital safety to be digital ready?
I think digital readiness is that holistic approach, isn't it? So we will all have certain digital systems that we use, and very often the providers that I talk to are like, "Oh, we're not a digital provider." I say, "Well, what do you do with your banking? Have you got HR system, payroll?" Like, if they're all online, then you are already on that journey to digital, even if it's not currently being used in your care operations. I think digital readiness is about, and interestingly, talking to you guys today, it's about having the processes and the policies in place that enable your staff to use digital and technology to do their job safely, securely, and effectively. That I think sometimes we get a little bit wrapped up in our sector in, like, policies are all about meeting regulations, policies are all about ticking a box. Policies are absolutely a tool that enable you to do your job the best. And if you want to be digitally ready, you want to have those tools. The analogy I make a lot for people is, we all remember when social media suddenly became a thing. We had staff members and we suddenly had to teach them what was and what wasn't appropriate to put on social media, and to understand how to use that. And we did that by putting policies in place that said, in relation to your job, here's how we expect you to behave on social media. And it did blur the line between the personal and the professional, because you don't want someone putting something on their personal and social media that implicates their workplace. Digital readiness is the same. We're a sector that uses our own devices predominantly. We've just done a piece of research about it. We're going to have a report about it later on, probably next month. That isn't in and of itself, although my NHS cyber colleagues would disagree, like a no. It's not a deathbed to cybersecurity. But you've got to get your organisation ready so that every staff member understands how they use that digital technology, what is and isn't appropriate, and what to do when things go wrong. And I think they're the kind of bedrock of digital readiness. And you don't need big, fancy IT support to do those things. They're all relatively simple. Our website has tons of the resources to get you there.
I think one of the things I used to say to staff quite a lot is like, well, I'm doing it in my own time, I'm out of work. And I used to say, but you put that you work at this home. So therefore, anybody reading that know where you work and think, would you want that kind of carer looking after my mum and dad? So I think the Facebook kind of analogy is really important for many people, because that's digital. And if that crosses over into the workplace, there's consequences. So, that digital readiness, you're right, it spans across the board. If you're using Facebook, if you're using GP records and all the other stuff, it's all there. We just need to connect it. So in terms of that DSPT tool then and the compliance, the Digital Care Hub has increased that from about 13% to, is it 70% now? What was the key to that success? And if a provider hasn't yet completed a DSPT, what's the simplest way to get started?
Yeah. So the DSPT, which is the thing that keeps me up in the night, because that's what our program is built around, is essentially a toolkit. And that is the thing I always come back to. Whilst, yes, publishing it kind of presents that you have reached a certain level of cyber maturity, the activity itself is a toolkit. It takes you through and literally says, here's the thing you need to do. Social care have our own special version, so it is written for us. So if you've ever, and most people are now registered on it, it can feel really big and overwhelming, but we have a whole program of support to get you there. The main thing is going through the toolkit will make you more cyber ready, will increase your cyber resilience. Now, I remember the days of the IG toolkit when I was sitting in a supported living provider and we had a tender and they said, have you done it? And we're like, no. And I had to do that. And it was horrendous. And many of us are still wearing the scars of that. I can hand on heart say that the 44 questions that are in the toolkit right now are applicable to what we do, are easily remedied, and are like kind of relevant to the kind of services that we are providing. So I would say, whilst it may not feel the most natural and the most comfortable thing to do, there is support out there. You don't have to do it on your own. We have a whole program of support. I have 30 local support partners who are probably your local care association who can handhold you through it. I have a video walkthrough of every bit of the DSPT available on our website. When you come to things like getting your staff trained, which has always been the biggest problem, I now have an e-learning tool on our website that is free to access, can be accessed from a phone, can be accessed by a mobile, takes about 20 minutes to complete the whole course, and means that the person is then at the level of training required to complete the DSPT. And when you get to the end of it, you can be like, okay, deep breath. We now know we have all these things in place. We also know the things we don't have in place and what we want to work towards. So, the DSPT is at its heart a really useful tool for providers. And if you are finding yourself not completing it because it's too big, too scary, you don't have the time, go to the Digital Care Hub website, put in your postcode, and we'll tell you who can help you. We have webinars every month to make it accessible for people. All the recordings of our past webinars are on there. Short of me personally going to everyone's front door, we couldn't be more hands-on in the support that we offer for this, and it's a rare thing. You will all know that very often requirements come in for us to complete with no support and no help. Yeah. This has been a real case of DHSC putting their money where their mouth is. They've really invested in this program because they really believe it's important for care, and they continue to. Now, the support won't be around forever, so if you haven't done it yet, make this summer the summer that you complete it.
It's very different, and the approach that you take to lots of those other big wieldy forms that we have to fill in for regulators and other bodies, to have that support there and people know where to access it, I think will really make a difference. Having that support there that's available for customers and anybody out there that's doing the DSPT, is really vital and needed. So that's a good one. But have you come across any outstanding examples of providers who've used digital tools to improve their compliance and care quality?
Oh, there's some really interesting things. And there's some of our providers are firmly rooted in the future, and it's really exciting. I think, though, and I'll go back to where I began, the best digital tools are the ones that help you move the kind of boring stuff out the way. They take away some of the worry, some of the risks. So I really like the Noble Lights, the kind of unobtrusive monitoring. We call it falls prevention, but it's not. It's early falls detection, because let's face it, the person's already fallen. But I want care to feel as much like a person's home and as unobtrusive as it can be. That, for me, is the heart of good care. And any technology that takes away the sterilization look of things, any technology that takes away someone knocking on your door 25 times a day, anything that makes it unobtrusive as possible, and again gives people the opportunity to do the cup of tea with Betty and have a chat, is the stuff. So I am a big fan of some of the note recording technologies that are coming in, because something that can organically record a conversation really does put that person's voice in to the notes. I'm not a fan, and I will put where it then gets tidied up by the AI and made into more formal language. I don't want to see that. Whilst I get that on the reporting side, on the other end, that becomes easier to read, it loses to me some of the truth. So, but I like those tools that, we know we have a workforce where there's a lot of people where English isn't their first language. So the idea of writing written notes is terrifying. Well, I want those people to stay in care. So I want tools that help them stay in care. Really love anything that is keeping people independent longer. So, the kind of home care companies, and there's a couple who are putting tech into people's homes. That means that their visits are less taken up with the administration of a person's life. The medicines, they're getting a cup of tea. They're putting technologies in place that enable people to do that through the day themselves, and therefore feels like added value. It doesn't feel like survival when their carer comes in the evening. So yeah, we do have actually on the website tons of success stories where we have providers come and talk to us about how they've transformed the care they provide. So rather than me name drop anyone and get in trouble for not name dropping the right people, because I definitely owe some people a few favors, go on our website and have a look. There's so many on there, and they're just brilliant stories, and we always tell them from the care provider's point of view. I think one of the things for providers to remember is that we are presented with technology as these big, highfalutin systems. It's DSCRs, it's radar technology. You can spend millions of pounds on technology, but actually some of the most effective tools are relatively small and relatively straightforward. I can tell you, things that we've implemented in my own team to help my team do their job, they've just been licenses for small technologies. They've just been things that, again, take away some of the barriers for them. In terms of like your administrators, it doesn't cost an awful lot to get something like Xero. It doesn't cost an awful lot to get a HR system. I mean, it can cost a lot to get a HR system. Let me not get in trouble with that one. But also, you don't have to buy the most fancy version. You don't have to buy the most expensive version. You have to buy the version that really is right for you. The thing we always talk about is decide what it is you want the technology to do, because the technology doesn't need to be a means to an end itself. Like, implementing a DSCR is not a means, like, that's not what we're trying to get to. We want the DSCR because it makes record keeping more effective, and in the future will enable us to, work better with the system. I am always a big fan of keeping in mind what is it that you're trying to solve with this technology, and that will sometimes stop you getting a bit starry-eyed, because software salespeople are incredible at their job and will, sell you rainbows and pots of gold, and really all you wanted was an easier way of keeping track of what time people finish their shifts.
What lessons have you learned then from working with the wide range of providers that you do across the country? Is there any regional variances? Is there any sector variances? So tell us the interesting bits. Who's getting it right? Who's not getting it wrong?
Do you know what? I would say almost everyone's getting it right. But what's really interesting is everyone's doing it slightly differently. So, I mean, sector variances are huge. The things that are working really well in care homes are very different than what's working in home care. We've just done a project looking at internet use and online safety for working age adults with learning disabilities, for example. The challenges that you're facing with that group are very different than you've got in a care home who are trying to deal with a population, with challenging dementia. I think geographically is interesting because we still haven't solved the connectivity issue. Some people are still working on a broadband that only works in the office. So, we talk again about these big ideas about everything being digitized, and some people can't use the internet in a residence room. Like, there are big challenges, and your more rural areas really face that. For me, more rural areas have got real opportunity there just for using things like video conferencing, to be able to check in on people more remotely, and, dipping into the toes of the NHS and things like virtual wards and increased monitoring, just, again, taking some of the obtrusion out of people having to go to appointments. I love GP Connect. I think it's a great technology, the fact that care homes have access to it, but it's really interesting to a certain population who are trying to keep people out of A&E. But I guess my biggest lesson has been, when you put something difficult and technical and scary in front of care providers, and you can show them how it really has a clear line to the improvement of care, they will embrace it wholeheartedly. Like, at every point in this program over the past 4 years, we've been like, we've capped out here. This is the most we can do. We're not, we got to 30% and we were like, wow, we're probably not going to get much further than this. We got to 40% and said the same. We got to 60% and the same. And I agreed to the 70% target with one eye closed, kind of being like, there's not a chance. But this program has worked because we've made the resources available. We've translated everything into the language of care providers, which I think is essential for anyone in tech talking to care, is you have to translate it into the language of your audience. Ultimately, we've held everyone's hand through it. We are, Digital Care Hub are your partner in deciding on tech. We just want everyone to have the opportunity to get the right tech for them at the right time in the right way.
And making it not scary. So many people in social care, me included at one point, we're old school. You know, we had to have our paper policies because that was our Bible, and
Yeah.
you know, letting go of that sometimes, and you still see it now with some inspectors when they come round. They want to see paper folders. They want to see
Yes.
that the managers signed all the policies and procedures, and they're happy with them up to date. We don't need to be there anymore. We've moved on, and it's if we can make that a simple transition for the people that haven't done that yet, we're going to give them what they want, and we're going to enable them to have the time back to deliver the best care. And I think your project and your programs enable people to do that. I'm going
Yeah,
to
I
move
don't
on.
want anyone
Yeah.
spending more time on the DSPT than they need to.
No,
That's really the heart of it. I want
Yeah.
to make it as easy and simple and painless as possible, and know that having gone through that process, even if it doesn't make everything perfect, because it doesn't, and it doesn't eliminate all risk, because it doesn't, they are better than when they started working with us.
If people access your website, there's so many resources on there, and you can click on it, and you're not getting lost because you're using big words on it, because the big words aren't there. You know, it's simple, easy to understand language, and it's broken down into easy steps. And I think that's a way forward. And I think other people should start taking a leaf out of that sometimes. You know, the simpler you make it, the easier it is for somebody to adopt it.
Yeah, I don't need anybody to go on my website and say, wow, these guys know a lot, because it's not about that. I don't need to pretend that explaining things in technical terms about APIs and, firewalls and all of this is going to make care any safer. Ultimately, we know that the biggest route into any organization is through poor password hygiene. It's through, not knowing what data you've got and where it is. And it's about not having things patched up to scratch. That is about your relationship with your software providers. You don't need to have a big IT supplier because you are purchasing a system. You should have a relationship where you are confident that they are keeping their security up to date.
So what changes do you think are coming next then? And what should providers be watching out for specifically?
So in cyber, there's a huge change coming for us. So the DSPT has done a wonderful job, but it is quite limited in how it evidences your cyber resilience. So the NHS is adopting something called the Cyber Assurance Framework. Now, the Cyber Assurance Framework is more technical in nature, and it's also evidence-based. So rather you tick and saying, yes, I've got it, no, I haven't, it asks you to show your kind of evolution of evidence. What we're hoping is that this program's next stage will be about supporting providers through that journey, and it'll be over the next 3 to 4 years. It's not something that's happening tomorrow. I think providers really need to get themselves ready for the AI transformation, because certainly if you are commissioned by local authorities, there's this, bandied about, digital first commissioning. Nobody knows what it means. Everyone's putting it in their tenders. There's a lot of push to use AI to reduce costs that I personally think is a bit of a fallacy. I don't think the opportunity is there, certainly not with the tools we've got today. But you as providers really need to understand what that means for your organization, have an understanding of what tech can do for you, but also what its limitations are. Tech is not the panacea. It won't solve all of your problems. It's a tool. And at the heart of that tool is making sure that the care you provide is still excellent, is still meeting all of your regulatory requirements, is still doing the job that you signed up to do, which is look after the people in your care. I am really lucky in the job that I do, that I get to see quite far down the line of what's coming in the future. I spend some time with robotics and, quite sophisticated AI. I've even seen a quantum computer in person. Don't get me started, because that's a whole other podcast where we will talk about my expertise in quantum computing, which probably ended at about 9:30 on that full day session when the maths lost me. But super exciting. These computers that can compute vast amounts of data simultaneously. And then I think how I go back to the complexity of the data we hold. I think I almost made one of the quantum scientists cry when I explained how little data architecture there really is about everything we capture, and how the vast array of data points that we hold about people who are in receipt of care. And then I was like, well, we could use this really sophisticated technology at some point, if we got the data architecture right, to predict people's kind of path in life and what care they need, and make sure we're giving them the minimum amount of care at the right time to keep them as independent as possible, so people aren't progressing into higher and higher levels of care needs. So there are some really exciting technologies coming down the road, but You don't need to buy them all. You don't need them all today. You definitely didn't need them yesterday. I would keep in mind that in amongst all of the hype and the fervour about things like AI, figure out what it is that makes you a better care provider and solve those problems with tech if those solutions exist.
Perfect. And I'm going to finish on one more piece. With all of your experience and your knowledge, if you could wave a magic wand, what would be the one thing you would change in the sector to improve cyber awareness and digital confidence?
I would have everybody take part in our cyber e-learning and our new gamified tool. Like, because then I just know everyone has seen the things they need to see. Like, if we could just have a magic wand and I know that everybody's done that training, because the training itself, the feedback we get is, oh, it's not that scary. It's not that hard, because it isn't. So if I could direct anyone anywhere, go and do our training. We're getting about 50,000 hits on that website a month at the moment, so it is gaining traction. But if you want to make sure your staff all know what's what, send them there.
We'll share the link.
Fabulous.
Thanks for today. Quite a lot of things to make people think, which is really, really good. And if people can get active and get on board, people will deliver better care.
Thank you so much for having me today. It's been brilliant.
Well, that's it for this episode of the Care Social. If you'd like to know more about Michelle Corrigan, check out her LinkedIn profile. If you'd like to know more about Digital Care Hub, check out their website. If you found this podcast helpful, share it with your colleagues. Have a topic you'd like us to cover? Comment below or email us at qcs@qcs.co.uk. Thanks for listening. See you next time.